Pancreatitis. Hey guys, today we're going to be talking about pancreatitis. So if that's something you or someone you love has experienced, keep watching because we'll be covering the symptoms, causes, diagnosis, and treatment of pancreatitis. Well, the pancreas is an organ that produces enzymes which help us digest fats and proteins in our food. With pancreatitis, patients will typically complain of severe upper abdominal pain radiating to the back. First of all, there is acute pancreatitis and chronic pancreatitis. Well, acute pancreatitis is usually a short-term or an acute illness. Patients usually present with severe abdominal pain, nausea, and vomiting. Well, one question we get quite often is, how is pancreatitis diagnosed? Well, the diagnosis of pancreatitis is usually made when there is a constellation of clinical features, meaning a group of symptoms and signs that point towards a diagnosis of pancreatitis. A patient will usually present with severe abdominal pain. Physical exam may reveal abdominal tenderness, guarding, and even decreased bowel sounds. However, with pancreatitis, the pain is usually worse after eating, and with kidney stones, the pain is usually worse when you move or change positions. Well, if you have risk factors such as a history of gallstones or hypertriglyceridemia, your doctor may recommend medications to help prevent pancreatitis. First of all, if you have severe abdominal pain, nausea, and vomiting, you may want to consider getting some intravenous fluids to prevent dehydration. Please remember to like and share this video if you think it will be helpful to someone else. As always, you can find the references and studies used in the description below. Thanks so much for watching, and stay healthy, my friends. You can also take over-the-counter pain medications such as Tylenol or Motrin, though you should avoid taking any anti-inflammatory medications such as ibuprofen or naproxen. If you have elevated triglyceride levels, your doctor may recommend a low-fat diet to help prevent pancreatitis. Also, if you have a history of alcohol abuse, it's important to stop drinking alcohol, as this may lead to chronic pancreatitis. Medications to lower triglycerides such as fibrate medications or even statins may be helpful. Also, if you have a history of alcohol abuse, it's important to stop drinking alcohol, as this may lead to chronic pancreatitis. With pancreatitis, patients may also have nausea and vomiting. Whereas with kidney stones, patients usually don't have much nausea and vomiting. Also, with pancreatitis, patients usually have elevated levels of liposi, or amylase, in their blood, whereas with kidney stones, those levels are usually normal. Lastly, imaging studies such as a CT scan of the abdomen will usually show findings consistent with pancreatitis, such as inflammation of the pancreas, whereas with kidney stones, an abdominal CT scan will usually show findings consistent with kidney stones such as small, round densities in the collecting system or urinary system. Blood tests will usually show elevated levels of pancreatic enzymes called amylase or lipase. Elevated amylase or lipase levels are found in about 80 to 90% of patients with pancreatitis. Abdominal imaging, either with a CT scan or an MRI, may show inflammation or swelling of the pancreas. A common test we order in our office is called an ERCP, which stands for endoscopic retrograde cholangiopancreatography. This is a test where we look at the bile ducts and the pancreatic duct to see if there is any obstruction in those ducts. If we find an obstruction, we can usually remove it during the same procedure. They may also be febrile, meaning they have a fever. In the case of acute pancreatitis, treatment usually involves pain medications, intravenous fluids, and sometimes even hospitalization. Well, warning signs include persistent vomiting, persistent abdominal pain, fever, and altered mental status. Red flags include signs of systemic organ failure, such as renal failure, meaning the kidneys aren't working well, liver failure, meaning the liver isn't functioning well as signs of respiratory distress, meaning the patient is having trouble breathing. If any of these warning signs or red flags are present, this may indicate a more severe course of pancreatitis, which may require hospitalization. In the case of chronic pancreatitis, treatment may involve pain medications, antibiotics if there is an infection, and in severe cases, even surgery. Blood tests will show elevated levels of pancreatic enzymes, called lipase or amylase. Imaging studies may show inflammation or swelling of the pancreas. Treatment options include pain medications, intravenous fluids, and sometimes even hospitalization. In the case of gallstone pancreatitis, patients may require an ERCP, which is a procedure where we go through the mouth and the esophagus and the stomach and the duodenum the first part of the small intestine. And then we go through the pancreatic duct and remove the gallstone, obstructing the duct. We usually do this by using a scope called an endoscope, and sometimes we use a basket to retrieve the stone. Chronic pancreatitis, on the other hand, is usually a long-term or chronic illness. Patients may have recurrent episodes of abdominal pain, weight loss, malnutrition, diabetes, mellitus, and even depression. Imaging studies may show calcifications in the pancreas or even atrophy of the pancreas. Treatment options include pain medications, antibiotics in the case of infection, and in severe cases, even surgery. Acute pancreatitis is usually caused by an obstruction of the pancreatic duct by a gallstone or an elevated level of triglycerides in the blood. It's called hypertriglyceridemia. Chronic pancreatitis is usually caused by long-term alcohol abuse, although other causes do exist. Some patients may even experience shoulder pain as well. This pain is usually worse after eating, especially if it's fatty or greasy foods. The pain is due to inflammation of the pancreas itself. If you have a history of having your gallbladder removed, you cannot develop gallstone pancreatitis. Another risk factor is a history of alcohol abuse. People who abuse alcohol over long periods of time are at higher risk of developing chronic pancreatitis. Patients who have elevated levels of triglycerides in their blood, hypertriglyceridemia, are also at higher risk of developing acute pancreatitis. Other less common risk factors include trauma, surgery, certain medications, infections, and even genetic disorders. Other common symptoms include nausea, vomiting, poor appetite, weight loss, depression, and fatigue. Less common but serious complications of pancreatitis include pancreatic pseudocyst formation, pancreatic necrosis, and infected pancreatic necrosis, which is called parapancreatic abscess. It also releases hormones such as insulin to regulate our blood sugar levels. Pancreatitis occurs when there is inflammation of the pancreas. When the enzymes that are produced by the pancreas become activated, while they're still in the pancreas, this can cause autodigestion of the pancreas leading to pancreatic necrosis and even pancreatic pseudocyst formation. This process is very similar to what happens with gallstones and cholecystitis. The main difference is that with pancreatitis, it's the pancreatic enzymes that are being activated inside the pancreas, causing all the damage, whereas with cholecystitis, it's bile, the S, being backed up from the common bile duct into the gallbladder, causing inflammation of the gallbladder. We'll also be answering some questions you may have about pancreatitis. So what are the risk factors for developing pancreatitis? Well, the first and most common risk factor is a history of gallstones. Another question we get is, how is pancreatitis treated? Well, treatment of pancreatitis depends whether it's acute or chronic. Alright guys, I hope you found this video helpful. By Joshi Joseph.